I have a number of patients who, when I recommended a medication, whether it's for blood pressure or cholesterol or diabetes or something else, I've had many patients over the years decline the medication. And when I asked why, they said they were afraid of the side effects. And so we are talking today specifically about side effects and how you should think of them. Now, first of all, I completely understand if side effects scare you. I want you to write in the comments if side effects have scared you off from a medication or made you reluctant to try something that your doctor recommended. Write in the comments, because I can tell you, if this is you, you are definitely not alone. But this is a really important topic. So let's just jump right in, all right? I'm going to give you basically about 7 sort of things to think about when you think about medication side effects. But I first want to start by telling you a quick story about a patient of mine that I had years ago when I was practicing in a different city and state than I am now. And this patient, her diabetes numbers were through the roof. She had a hemoglobin A1C. That's a 3-month average of her sugar numbers. Those of you who are diabetic or have family or friends that are diabetic, her A1C number was 13%. Which means that her blood sugar was in the hundreds every day, very, very high. And I got her labs back. She was a brand new patient to me, and I brought her in. I said, your numbers are high. We need to start you on medications. And she said, well, what medications? I said, well, we really need to start insulin at this time, and blah, 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 blah. And she literally almost, I thought she was going to pass out when I said that. And I said, tell me what's going on. Tell me what you're experiencing. And she says, I'm not going to take insulin. I'm not going to take any meds. I'm not taking diabetic meds. I'm not doing this. And I said, well, tell me more. And this was really important because you know that I wasn't the first person or first doctor to recommend diabetic medications. And her A1C didn't just turn 13%. It'd been like that for a while. But the long and the short of the story is she told me that her mother had diabetes and had really bad diabetes, and had it for years and years and years. And the minute that she was put on insulin is when her kidneys started to fail, and when she ended up in the hospital, and she soon after died. And so my patient, as we were talking, I realized that my patient associated insulin not with treating diabetes and getting her better, but she associated it with the end. Because in her mind, as soon as her mother got on insulin, that's when her mother started going downhill. That's when she went on dialysis. That's when she became hospitalized, died, etc. And my patient thought insulin was bad. She thought that a side effect of the medication was badness. And she felt that the medication side effects, which she assumed and felt was, harming your kidneys and causing hospitalization, she said, I don't want that. She didn't want that. So let me just first make a statement about this, because I have a lot of patients who've told me similar stories. One of the first things I want to say is that there's a difference between an association and a true side effect, like something that there's a difference between these stories I'm telling you and side effects. A side effect of insulin is not necessarily kidney failure, but these are associations that my patients made because of their personal experiences. So one of the things I want to encourage you all to do, by the way, is to think very closely about your experiences in your life, what associations you might be making because of your personal experience. It's not to say your personal experiences aren't important or that it doesn't matter. They do matter, but there's a big difference between when someone goes on a med and becomes sick versus that med causing them to be sick. And in most all of the situations that my patients have told me about, from listening as a physician, my opinion is not that the medication caused the problem, but that the problem was already in process. And, they happen to be put on a medication around the same time. Okay, that's my personal belief. So first of all, medication side effects are real. This video is not to tell you that medication side effects are not real and that it's all in your head and you're making it up. That's not what I'm here to say. Medication side effects are real. I'm not your doctor, so I cannot give you medical advice. Make sure you talk to your doctor. But we do know that classes of medications can have side effects. ACE inhibitors, that's the prill medications for blood pressure, can cause a dry cough. Side effect. So first thing, I've got 7 things for you, okay? First thing I wanted to mention is that let's remember that everything potentially has side effects. Everything. Okay. Not taking medications has side effects, by the way. Taking Tylenol, taking Motrin, taking over-the-counter medications have side effects. Supplements can have side effects. Anything and everything we do can have side effects. So the first thing I want to encourage you is to not be thrown off by the fact that your doctor is suggesting medication simply because it could have side effects. Because you know what? Everything can have side effects. Second thing is, remember that, I know when you open that patient information, that prescriber's information, that patient information in the drugs, you go to pick up your pharmacy, your medications from the pharmacy, and you open the packet, and the packet has a very long list of side effects, and you're like, oh my gosh, it is so scary, I know. Or when you watch on the TV and you hear an ad for a medication, and then it says, this medication will make you, it tells you how great the medication is, and then at the end it's like, don't take this medication. If you have this, it could cause this. And you're like, what? By the way, drug companies have to mention those things, okay? But first of all, because it exists doesn't necessarily mean that you will have it. Number 3, goes back to what I was just saying. Drug companies have to list all potential side effects, okay? Once again, it doesn't necessarily equate to the likelihood of you getting it, but they've got to list it. Number 4, remember that let's say you take a medication your doctor prescribes or what have you, and you get a side effect. Remember that it's not often the end of the world. Now, let's be clear and let me be honest. I'm not here to sugarcoat things. Some side effects can be very, very severe. Some side effects could be even deadly. Some side effects could be disabling, disability, have black box warnings, could be really bad, even result in death. I'm not going to say that's not the case. What I am going to say is that medications with those side effects are far, far, far fewer than medications without those potential side effects. And generally those medications we really, really handle with care, okay? What I am saying is for the vast majority of medications, if one gets a side effect, oftentimes these things can be reversed. The medication dose can be lowered. The medication can be stopped. The medication can be changed. The medication can be, you can change it the time of day. Number 5 is probably one of the most important things I have to say is that you've got to weigh the risks and benefits of these things because once again, anything and everything can have side effects. So in medicine, no one is saying that medications don't have side effects. What we're saying is that we believe the benefits you and your health will get from taking this medication far outweighs side effects that you may not get at all. And if you get them, we feel like we can manage what we need to because the benefit of you taking them far outweighs the risk of you not. And that's a huge and important conversation you have to have with your doctor, which is why I'm talking about this. Before you just tell your doctor, I don't want it, or no thank you, risk of side effects, you need to understand why they want you to want it or why they want you to take it. You may not understand how much danger or how much risk you may actually have with the condition you're dealing with. You may not understand how bad it potentially could be. And this is not saying this to scare you, it's saying this is why a conversation needs to be had. The next one, side effects are not always bad. Now let me tell you about this. I have a patient and he wanted to stop smoking. So there's a medication on the market called Chantix. And I will always remember this. He wanted to stop smoking. Chantix is on the market. My experience with Chantix when I prescribed it for patients to quit smoking is sometimes patients get nauseous. Sometimes patients also get vivid dreams, like the kind of really crazy vivid dreams, right? And my patient, came back to me for a follow-up. He was like, hey, Dr. Jen. I was like, okay, how did you do? I was like, are you getting the dreams? He's like, yeah, they're great. I said, what? He's like, I think they're really interesting. I said, wait, are we talking about the same thing? So side effects are not always bad. And then the last thing is side effects are not all created equally, right? Which means that even though on that list, when you open it up and you see all of these side effects that are listed, it doesn't mean that you're equally as likely to get all of them. There are going to be side effects that are more likely than others. And generally, I can tell you that medication side effects that are the most common are GI side effects, gastrointestinal. That's nausea, diarrhea, upset stomach, maybe vomiting, nausea, that kind of stuff. Side effects is not a reason to not take a medication, is the bottom line. It's something that has to be decided with your doctor. What I am telling you is to talk to your doctor about your concerns, talk to them about your side effects, talk to them about your symptoms, how you feel, talk to them about your experiences, so that you both can come up with the best treatment plan for you. Anyway, guys, I love y'all. Okay, I'll talk to you soon. Bye.